Welcome to Vive Health. My name is Dr. Nikki Bechtel, chiropractic physician. Today we're going to be discussing some easy, simple exercises that can be done for your most common low back pain. Those of us that suffer with radiating pain that goes into the right leg or the left leg, just some easy stretches to help alleviate that pain. I would like to introduce to you the side glide exercise. In my office, so oftentimes what happens with low back pain that is radiating, oftentimes we will call it sciatica, is that pain is radiating into one side or the other. What happens is patients often will come into the office leaning in a direction. The body is smart enough that when we have a disc herniation, the body is going to lean away from the side of herniation. Because therefore, when we come back up, what we're actually going to do, for lack of better words, is we're going to smush that disc and cause that pain to be more uncomfortable. So the body is smart enough to know that we need to lean away from the area of pain. Therefore, with the side glide exercise, this is going to be done against a wall. We're going to put the side of pain into the wall. Therefore, if I had sciatic-like pain, a radiating pain down into my right leg, and therefore I was walking into the office like this, what I'm actually going to do with the wall to my right side is I'm going to bring my feet approximately 12 inches away from the wall. My right elbow is going to be tucked against the bottom of my rib cage. This will be against the wall. I'm now going to take my left hand onto my left hip, and very gently I am going to push my left hip into the wall. It is a very gentle hold. I usually tell my patients to hold for 3 to 5 seconds and then go ahead and let it release very slowly. You are going to continue to do this for 10 repetitions. So again, left hand on the hip, pushing into the wall with our arm bracing us against the wall. Hold for 3 to 5 seconds as long as it is comfortable, and then you are going to repeat that 10 times. You will notice that what this is going to do is take that radiating pain and cause it to be more centralized. So you're going to feel that discomfort come up and out of that right leg and more centralized into the low back. Again, this is a side glide exercise, wonderful those who have radiating low back pain and a history of disc herniations. Let's discuss one of my favorite exercises, which is called the press up exercise. This exercise is simply to strengthen the low back and to strengthen the core. This is the perfect exercise for people who have a history of low back pain. Now, I prefer in my office to tell patients to only do this exercise if they are not symptomatic. This is a wonderful exercise for prevention of low back pain and to help to strengthen the disc. Simply what we're going to do is we're going to lie flat on our stomach. You're going to keep your low back and your buttocks relaxed. Hands are going to go directly under your shoulders. Head is going to be relaxed in a neutral position. And what we are going to do is we are going to slowly lift up into extension, only using our arms to lift us up until we get to a locked out position. At a locked out position, you are simply going to take a deep breath in and lower yourself down as you slowly exhale to the bottom. Now, I like to tell my patients, again in my office, that we lift very slowly. We hold in this upright position for the count of 3, and then we're slowly going to allow ourselves to come down. We repeat this exercise 5 times. Now, for those of you that have stiffness in the low back or tightness in the hips, you are going to find that this position is very hard, very difficult to do, and can be uncomfortable. So what you will do is you will then lift your pelvis up with you to do this exercise. And then when you get to the top, you'll slowly relax those hips to try to meet the ground. Keep in mind, this can be a difficult exercise to do and can take a while to accomplish. So don't get discouraged. This should be done twice a day. Hold for the count of 3 at the very top. Let those hips relax into the floor and then slowly lower yourself down. I would like to introduce to you the trunk rotation exercise. This is wonderful for increasing mobility in the low back as well as the hips. You're simply going to lie flat on your back. We will then pull our knees to our chest, hold for the count of 10 while taking a deep breath in and exhaling all the way out. We will then place our hand next to our side, opposite hand on the legs, and we will pull the legs to the side. Now, by doing this rotation, you want to make sure that you continue to keep the pelvis relaxed and as close to flat on the floor as we can possibly get. You will hold this for 5 to 10 seconds, and we will repeat this exercise 10 times. Again, coming to the opposite side. You will notice with each repetition, this exercise will become easier. We'll then exhale at the end, laying the legs slowly flat on the floor. That is the trunk rotation exercise to increase mobility in the hips and the low back. Allow me to introduce to you the perfect stretch for the piriformis. The piriformis is often the culprit of sciatic pain. This exercise should be done daily, 2 to 3 times per day. This is called a figure 4 stretch. We are simply going to lie on our back, knees bent. You are then on the affected side. That leg, that ankle, is going to go over the opposite knee. You will then place your hands on the leg that is not affected behind the hamstring. You will simply then pull this knee towards your chest. You will feel this stretch into the hamstring as well as into the buttocks. We hold for 15 to 30 seconds, and then slowly you will allow this leg to come down, go into a knee bent position, and then we will repeat this exercise on the unaffected leg. Again, pulling the knee to the chest, feeling the pull into the hamstring, into the buttocks. Hold for 15 to 30 seconds. Repeat this stretch 3 times and twice daily. Let me introduce you to one of my favorite exercises to add to your morning routine. This is a simple exercise to help to relieve low back pain first thing in the morning and avoid stiffness. This is called your knee to chest exercise. This can be done on the floor or you can simply do it in bed. What you're going to do is lie flat on your back. One leg down. You are going to simply put your hands behind your hamstring or behind your knee, and you are going to pull your knee to your chest. You are going to take a deep breath in. Exhale, and as you exhale, you are going to pull that knee as close to your chest as you possibly can. Hold for 15 to 30 seconds. Slowly, you are going to release it, and you are going to repeat on the same side. This exercise is wonderful to do first thing in the morning to avoid stiffness when getting out of bed. Again, deep breath in. Exhale, pull the knee to the chest. Hold for 15 to 30 seconds, and then go down to neutral. This can be done both morning and night. Again, this is the perfect stretch to do to increase range of motion in the low back and mobility in the hips. Remember, with any stretching exercises, if the pain worsens or exacerbates, please stop the exercise immediately. Always consult your physician, chiropractor, or physical therapist first prior to starting any stretching protocol.